This video is going to be on fragmentation hemolysis. Fragmentation hemolysis occurs when the red blood cell is broken within the blood vessel. So this is either a disease of the blood vessels or it's a disease of the red blood cells in that they're more fragile and can break easier. Diseases of the blood vessels that can cause fragmentation include hemangiosarcoma, disseminated intravascular coagulation, or DIC, and vasculitis. Hemangiosarcoma is a neoplastic proliferation of endothelial cells. So it's a cancer of blood vessels, and this tumor forms tortuous blood vessels, so really irregular blood vessels. And because of all the turbulent blood flow going through those irregular blood vessels, the normal red blood cells get sheared as they move through. DIC is when there's activation of clotting within the blood vessel, and there's deposition of strands of fibrin within the blood vessel. And these fibrin strands lyse or shear the red blood cells as the red cells move through the blood vessel. Vasculitis also activates clotting within the blood vessel, so you can have deposition of fibrin within the blood vessel, and again, the red cells are being sheared as they pass through that fibrin. Fragile red blood cells, that most commonly occurs with iron deficiency anemia. The most specific thing that we look for to identify red cell fragmentation is schistocytes. This is when the red cell is slashed and there's a small irregular fragment of the red cell circulating in blood. Acanthocytes can also occur with fragmentation. These are red blood cells with multiple irregular projections coming out from its surface. Now, acanthocytes have to be differentiated from echinocytes, which are cells that have multiple regular projections coming from its surface. Now, acanthocytes are not specific for fragmentation. They can also be seen with liver disease and various disorders of lipid metabolism. Keratocytes is a sign of fragmentation, and these cells have little blisters on their surface. If the blister were to rupture, then there would be two projections from the surface, and it would look like Dracula teeth. And if one of Dracula's teeth were to fall off, then you just have one projection. So you can think of this as a one-tooth Dracula. Keratocytes are not specific for fragmentation. They can also occur with oxidative injury. Now, in contrast to the other causes of hemolysis, fragmentation tends to cause mild hemolysis, so you don't expect to see the gross clinical signs that you would see with the other causes of hemolysis. So you tend not to get severe anemia, you tend not to see icterus or bilirubinemia or bilirubinuria or hemolysis. So that's it for fragmentation hemolysis. It's usually a disease of the blood vessels or fragile red blood cells. The most specific change you see is schistocytes, but you can also see acanthocytes and keratocytes.